Okay, so when you book in, we get you to fill in a questionnaire that gives us a background history on development health. We do a symptom survey, and the survey is designed to cover those more, not only sort of what we call visual symptoms, blurry vision, headache, sore eyes, tired eyes, but also how it might impact on academic and learning performance. So we ask questions around how well they're paying attention, how well they concentrate, what do they have difficulties with. And then when we do a case history, we're asking some very specific questions on the kids and what we like to use is open questions. So we make sure we're not leading the witness. So we're not asking questions that sort of end in yes or no. So getting a sense of the things that the kids like and don't like, because that tells us a bit of a hint into things that might be visually difficult for them versus those that are easy. And once we've done a case history, we then get into testing. And, we will test the obvious things like, can you see clearly? Do you have much in the way of refractive error, which is myopia, astigmatism, longsightedness, those sorts of things. But we then do a very extensive test of eye movement control. We call that ocular motor skills, eye teaming, which is also known as binocular vision, convergence, divergence, those sorts of things. A detailed test of accommodation, which is the technical word for focusing. And we're looking about the relationship of how focusing and eye teaming work together. And then depending on the age of the child and their presenting concerns, as we will do a screening of their visual processing skills. How well are they able to understand and manipulate mentally visual information presented to them? And then we'll wrap that up with some eye health screenings and eye health checks to sort of round it all out.
So it sounds like there's a subjective assessment component to it where you're like getting, responses and feedback from the patient, but there's also an objective element to it as well. So even if it's a very young child who's not very verbal, you can still test for functional vision.
Yeah, absolutely. And we do a lot of objective testing in terms of being able to watch how they focus, being able to watch how the two eyes work together. People sort of say, oh, look, like young kids, they can't read the letter chart yet. Well, we rely on a lot of those observational tests, and also we have charts that are suitable for kids who are pre-literate. So we use Lear symbols, they're called, which are well-normed shapes to get us a very good handle on how well they're seeing.
And how long does the assessment usually take?
We normally book 45 minutes for an initial assessment, and that covers comprehensive history, doing that comprehensive exam, and then leaving plenty of time to discuss what we've found, what the alternatives of care are, once we've got all that information in front of us.
And do parents usually stay in the room during the assessment? I think it potentially could be a bit intimidating for some young kids.
Yeah, look, in our practice, we always have the parents there. There's always questions to be asking as we go along. We might observe something that would create a question where we say, hey, I've just noticed this. Does the child ever do X, Y, and Z? So something we may not have necessarily asked in the case history means we can kind of link it to something we're seeing. It also allows us to demonstrate some of the difficulties on the spot that we might pick up in children. So it's a very important educational piece to bring the parents on the journey of what's actually happening and how kids use their vision and those sorts of things.